procedure for obtaining an ECG is to make sure to verify the physician's order. Second is to confirm the client's identification. Compare the client's name to the ID bracelet. Sir, ano pong buong pangalan niyo?
Lapito S. Artenciado.
Kailan po kayo pinanganak?
August 18, 1938.
Provide privacy and explain the procedure to the client. Wash his hands, don gloves, wear face shield and gown if needed to follow the standard precaution. As you set up the machine to record a 12-lead ECG, explain the procedure to the client. Tell the patient that test records heart electrical activity may be repeated at certain intervals. Emphasize that there's no electrical current will enter his or her body. Tell the patient that the test typically takes about 5 minutes. Ask the patient about allergies to adhesive as appropriate. So good evening po sir. I'm your student nurse, Angelo Quijano. Dito po ako ngayon para mag-obtain po ng ECG. Ang ginagawa po ng ECG is malalaman po natin yung activity po ng heart nyo para po malaman natin yung kalagayan nito. Umaabot po ito ng 5 minuto. Sir, may allergy po ba kayo sa adhesive?
Wala.
Place the ECG machine close to the client's bedside. Plug the power into the wall outlet. If the bed is adjustable, raise it to comfortable working height, usually the elbow height of the caregiver. Have the patient lie in semi-forward position, in the center of the bed with arms at the sides. Raise the head to provide comfort. Expose the patient's arms and legs and drape appropriately. Encourage the patient to relax the arms and the legs. Kamay po sa gilid. Ayan po. Straight po yung legs. Tapos, dapat naka-expose yung legs sa kanyang arms. Sabihin na lang po tayo and relax lang po. Select flat and fleshy area on which to place the electrodes. Avoid muscular and bony areas. If the area is excessively hairy, clip the hair. Do not shave the hair. Clean excess oil and other substances from the skin. Use it with soap and water, and then dry it completely. Apply the limp lead electrodes. The tip of each lead wire is lettered and color-coded for easy identification. The white or RA lead goes to the right arm. The green or RA lead goes to the right leg. The black or LA lead goes to the left arm. Peel the contract paper of the self-sticking disposable electrode and apply directly to the prepared site as recommended by the manufacturer. Position disposable electrode on the legs with the lead connection pointing superiorly. Connect the limp lead wires to the electrodes. Make sure that the parts of the electrodes are clean and bright. Expose the patient's chest. Apply the precordial lead electrode. The tip of each lead wire is lettered and color-coded for easy identification. The brown or V1 to V6 are applied to the chest.
V1, fourth intercostal space at the right sternal border. V2, fourth intercostal space at the left sternal border. V3, halfway between V2 and V4. V4, fifth intercostal space at left mid-clavicular line. V5, fifth intercostal space at anterior axillary line. V6, fifth intercostal space at mid-axillary line level with V4.
Connect the precordial lead wires to the electrodes. Make sure that the metal parts of the electrode are clean and bright. After the application of all lead wires, make sure that the paper speed selector is set to 25 meters per second. Second, make sure that the machine is set to full voltage. Ask the patient to relax and breathe normally. Instruct the patient to lie still and not to talk while you are recording the ECG. Okay sir, relax lang po tayo. Huwag po tayo magsasalita kasi po nagre-record po yung ECG natin. Hinga lang po tayo sir. Relax lang po. Press the auto button. Observe the tracing quality. The machine will record all the 12 leads automatically, recording 3 consecutive leads simultaneously. Some machines have display screen, so you can preview waveform before the machine records them on the paper. When the machine finishes recording the 12-lead ECG, remove the electrodes and clean the patient's skins, if necessary, with adhesive remover for sticky residue. After disconnecting the lead wires from the electrodes, dispose the electrodes. Return the patient to comfortable position. Lower the bed height and adjust the head of the bed to provide comfortable position. Okay po sir, thank you po sa cooperation. Pwede na po kayong humiga and make yourself comfortable. Thank you po sir. Observe and practice body mechanics all the time, and make sure that you show calmness throughout the procedure.